class.
Ma'am, my BP very low, due to which I cannot attend my class. My
Okay.
BP low.
Okay. Why? Is there any specific reason?
Ma'am, I have pregnant.
Oh, I was thinking of it. Congratulations. Just take care
Thank
of your
you.
child.
Thank you. Thank you.
And I'm so proud of you that even in this condition, you are putting an effort to study. Hats off to you. Okay.
Thank you. Thank you, ma'am.
Okay. Priya,
Good evening, ma'am.
good evening. Shashikala, Bhavna, Rupa, Govindraj.
Hello, good evening, ma'am.
Good evening, ma'am. Good evening, Priya.
Yeah. Good
Shashikala.
evening, ma'am.
Good evening. So you have changed your location, Shashikala, today?
No, ma'am, that location only. My door was locked. So
Today's the door is locked today. Yeah, I can.
No, I
So
can't
where is your
open my
friend Govindraj? Colleague.
I don't know. I didn't speak Govindradana today.
Govindraj, please talk to Shashikala. Good. Uzma, Bhavna.
Yes,
Yes,
ma'am.
ma'am.
I got 17 marks out.
Okay, I'm saying that a drainage, this is a drainage chamber where you will remove the fluid into this chamber and all the fluid will be collected over here due to just a simple diffusion from high pressure to low pressure. Yes or no? Air will
Yes,
also
ma'am.
move through this tube and this air will go into this tube. Because air is lighter, it can move into this tube. Yes or no?
Yes,
Yes,
ma'am.
ma'am.
High concentration, low concentration की तरफ और low concentration, high concentration की तरफ.
High से low concentration की तरफ.
Okay.
हाई से लो. ऑस्मोसिस वो अलग है. वो जो आप सोच रहे हो वो अलग चीज है. यहाँ पे कोई भी चीज हाई से लो ही मूव करती है. हाई से लो मूव करेगी. ओके. So from high concentration, the fluid will move and collected into this drainage chamber. The extra air will be come and this is going to be collected in this tubing.
Water.
Okay, this water, and this water will bubble up, extra fluid bubble up, and this will go out from this vent, and this is your suction chamber. Okay, let me show you again with a more good diagram so you can understand better. This was a base. Okay, everyone put your attention 100% into this chest tube. I'm going to explain you chest tube from very beginning. Okay.
Yes, ma'am.
Yes, ma'am.
So look at this setup very, very carefully and appreciate. So in your lungs, there is air. This air, blue color air, can you see?
Yes,
Yes, ma'am.
yes,
There is fluid over here at the base,
yes, ma'am.
and this lung has been collapsed.
Yes,
Yes.
Yes.
yes, ma'am.
Okay. Now, if we want to remove the fluid as well as air from this cavity, there will be a positive pressure. So you need to create a negative pressure or suction so you can suck out the air as well as fluid from the cavity.
Yes, ma'am.
Okay.
Yes, ma'am.
So
Yes, ma'am.
you want to create a suction or negative pressure. Suction is just a negative pressure. So there is one connection. This is also connected to this, and this is also connected to this. So there is negative pressure.
Yes,
In
ma'am.
this chamber, there is negative pressure. So due to
Yes.
negative pressure, the fluid as well as air is moving into this cavity. There's two things. There are two forces are acting: gravitational force as well as suction force. So both of them are working together, and we can collect the fluid into this chamber. Can you see the fluid is moving into this chamber?
Yes, ma'am.
Fluid collection bottle. Can you see this is the drainage chamber?
Yes,
Yes,
Simply
ma'am.
ma'am.
the fluid is
Yes,
being
ma'am.
drained. If you want to collect fluid, if you want to remove air also from this cavity, what you will do? You will just add this tubing into this bottle. Understand, these all three are closed chamber. All three are closed. If there will be break in circuit, there will be no pressure, there will be no negative pressure, and then fluid cannot come out as well as the air cannot come. So these three need to be very close, tightly secured, and negatively pressure should be there. So the air molecules will move up into this chamber. Okay. And can you see you have sealed it with the water? So only it is one-way channel. Only air can come out, but it cannot go out because you have a negative pressure of 22 as compared to the atmospheric pressure. If there is more pressure over here, then water would also have moved. But you have maintained such a pressure that only one way, it is acting as a one way, that only the air is moving out and water is not going up. If you change the setting of the pressure, then vice versa can happen. Like fluid can also move up in the tubings. But no, you have just created a good pressure, 22. That's why the fluid is not going back. Only the water is going up. Can you see the water vapors from this has been into the chamber? Now, this water vapor, not water vapor, sorry, this fluid air will pass into this tubing. Okay. Now
Yes, ma'am.
you want now it's very important to understand this thing. Till now, did you understood? I will repeat it again, and so you can understand again. Just follow with me.
Ma'am, why there is three bag, ma'am?
That's why
Why there is
that's why I have not taught you about the last one till now. I want you to understand these three. Do these two first very clearly, then I will come to the last bottle. Okay. Just imagine you want to remove fluid as well as air. So what you do, you collect, you had just made a three bottle, a closed circuit. Over here, the fluid is being draining out and it is being collecting over here. Yes. Okay.
Yes.
yes, ma'am.
The air is moving out. It is being
Yes, ma'am.
bubble, and this bubble is going out into this chamber. Okay. Now understand one thing. I want to create suction as well as I want to remove gas from the tubings. The fluid I have been collected. Fluid I can collect, but air I cannot collect because air will act as a pressure. Yes or no?
Yes.
Yes.
So I want to create pressure as well as remove the airway. So I want a vent. This is called as a vent. Now what will happen? Air will get mixed into this thing. Okay. And there will be a high negative pressure. But
Yes,
when
ma'am.
air will come out of this chamber from these tubing, it will decrease the pressure because there's
Yes,
so
ma'am.
much of buildup. So what will happen? The fluid will get mixed into this thing, this water, and this extra air will easily move out. And then we will have a good suction working over here. Because you cannot directly remove. Okay, you can combine these two things. but you cannot evenly remove air and create a suction at the same time. That's why we have one extra tubing. This is called pressure because this will regulate the pressure. You cannot regulate pressure as well as water seal together. You cannot combine these two. It will be very difficult to maintain suction and remove air at the same time. That's why we have 3 bottles. Understood?
Yes, ma'am.
One more time I will explain. But again I will explain. Look at this. You want to remove this fluid as well as air. You have connected a tube. Okay, there's a negative pressure, there's a positive pressure. So positive to negative fluid will easily be connected. Extra air will go and it's going to form a water seal. So only air can move, no extra fluid, nothing can move. Okay, and you want to create a suction pressure continuously, suction should be there. So now air will go up into this chamber, and from this there is a valve which will remove excessively air, and there's a suction which will create a suction requiring for the bottle. Suction will maintain from this thing. What this is a water seal and this is a drainage chamber. Did you understood till now?
Yes, ma'am. Yes, ma'am.
Now, what have scientists have did? They had combined all 3 bottles into a box, which is called a chest tube. A now modern chest tube, but whole basic science of these 3 bottles. We had combined this 3 bottle into a bag because it was becoming very like 30, 40, 50, 60 years from now. These mechanisms were used, but it was very difficult for us to maintain the suction of closed setup. That's why it was there was a leakage in the bottle, and hence it was causing more problem to the patient. So nowadays, what we have did, we have combined all this thing into a box, which is called as a chest tube, modern chest tube. Let me show you how modern chest tube look like now. This is a modern chest tube. Oh, what is this? Okay. You can't see this, right? This, give me 1 second. Okay. Can you see this very, very carefully and very, very nicely?
Yes,
On my
ma'am.
screen? Okay, cool. So, let's see. Can you see 10 ml, 20 ml, 30, 40, 50, 200, 190, 2000 ml? So what is this?
Yes,
ML
ma'am.
means volume. Volume means these are your drainage. Starting from here to here, it will flow like this. Maximum capacity. So this is your collection chamber. You can call it drainage chamber, whatever you feel like, you can call it collection chamber. Okay. Now, can you see this chamber?
Yes, ma'am.
This chamber. This is your water seal chamber. Second bottle about what I have made. You remember the bottle?
Yes, ma'am.
Yes.
Let me keep this very parallelly to each other. Can you see this water seal bottle? Can you see this water seal chamber? They work same. So they are same purpose. Understood? Pressure regulating
ma'am.
bottle. Can you see this patient pressure? No, can air leak. You can call it pressure regulating. You can also call it air leak. So it prevents the air leak. It maintains the section. Okay. So these three bottles have been decided compact into a box which is called as what is called chest tube.
Yes,
Okay. And what is this? There are two types of suction, dry suction and wet suction. In dry suction, you have a dial which we manage the suction from this dial. Okay. In wet chamber, there is a column of fluid. Let me show you the wet chamber also.
Oh, this.
So this is your wet chamber. There's a dry chamber, there's a wet type of two type of chest tube we have.
Chest
Wet
tube.
type and dry type. So dry type is with a dial, and this one more is your wet. Can you see there's no dial over here? This is a wet type. There's no dial.
Yes.
Can you see? This is the collection chamber. This is your water seal, and this is your air leak. Third chamber. This is your dry kind of. Look at this two type chest tube present. Dry suction and wet suction. Can you see this? There is the dial over here. This is dry type. This is wet type. Okay. So there are two type of suction chest tube available. You know, dry suction, water seal, dry suction water, and then wet suction seal. Understood?
Yes.
This is the modern one. Now it's same principle based on the earlier. Understood about chest tube? Basic, how does your chest tube work? Uzma, Rupa, Bhavna,
Yes, ma'am.
Yes, ma'am. Yes,
Sundar,
ma'am.
Junaid, Farhad, Priya.
Yes, ma'am.
Junaid, Noon.
Yes, ma'am.
Yes, some male voice I can hear. Why our male community is so low? Emule? Do you fear from women?
I think they don't like nursing, but they have to do their job for earning some money.
Oh. Is this a case? Farhad? Farhad?
No, ma'am.
In
Male
Pakistan,
No,
a
representative.
ma'am.
male nurse feel like that they public abusing them to call a nurse drip to utarna.
No,
No,
ma'am.
no, you don't
She
know how
has.
good nurses we have. Male nurses.
No,
Come
ma'am.
on.
She has her own perspective that, but this is not true.
Yes. Farhad, no. Anyone can do this thing. As a female, we can be a doctor. Listen, one thing I want to explain you, okay? Leave it. Where were we? We were talking about chest tube. Understood all details about chest tube. Okay. Now comes the important thing that you need to write. Write 3 things in your notebook. First, write drainage. Do you know what drainage chamber is?
Collecting chamber.
Drainage. You can call it collection chamber, collection bottle, anything you want to, just call it. Okay, up to you. First thing, there should be no tidling. Should be, because understand there is vacuum and the fluid is being collected. So there should be no turbulence, no tidling. There should be no tidling. Understood?
Yes, ma'am.
Second thing, monitor.
Sorry to interrupt you, ma'am. Can you explain tiling?
Okay. Whenever you pour water, so there's wave. So wave is the tiling. Okay. That we don't want. We don't want. It's okay. Understood. It's okay. Monitor fluid of the drainage. So you need to look at the fluid of the drainage and to comment on the fluid. Okay. Look at the color. Look at the consistency. It should be not bright red. If there is bright red, report. Because bright red fluid of blood indicate active bleeding, hemorrhage, patient is going into shock. Report it right now. Next, there should be no odor. There should be no foul smelling. These
The
all
monitor fluid of, can you please repeat from the monitor fluid?
okay, monitor fluid of the drainage. Okay. Look consistently, you need to monitor fluid. There should be no change in the color. Okay. It should be not bright red. There should be no obnoxious odor coming from the fluid. There should be no foul smelling. There should be no bright red color or big clots. When you're seeing all this stuff, it means that there's active hemorrhage, and active hemorrhage is not expected. Okay. And if a fluid is draining is more than 100 ml per hour rate, if a fluid, okay. Okay. 1 hour ago, the fluid was over here. And after, okay, at 1 p.m., the fluid was over here. And when you check the fluid at 2 p.m., it was at 300. It means that within 1 hour, there's a 200 ml of fluid has been drained out. It means that a patient is going through active hemorrhage, there's active bleeding in the body. You need to report. More than 100 ml per hour, just go and report. Alert. Okay?
Yes.
Next, write about water seal.
See.
Purpose. What is the purpose of water seal? Anyone? What is the purpose of air seal? Yes, water seal. What is the purpose of this bottle? Farhad, Priya,
Name.
Junaid,
Water.
Govind.
Ma'am,
I
fluid
think it prevent backflow.
I
like
think it is
prevent
to
air
vacuum the
One by
air.
one. One by one. Text. Use your
I think it is
texting.
to it is for vacuum.
Air should not go upward.
Yeah.
To remove air.
Air.
Yes, to remove air from your lung cavity. Understood? This is the primary person. So write it out. To allow the exit of air and prevent the air to enter the pleural spaces. Both. To remove air and to prevent the water to go back into the pleural space. Both the thing is being responsible. Okay. Okay. Can you write the purpose? To allow exit of air and prevent the air to enter pleural
Pure
cavity.
space.
Understood how, why, when, कैसे कैसे सब कुछ समझ में आ गया? Okay. Next, understand one thing. There is tidling. Okay, there is tidling expected. So why there's a tidling? So whenever we take breath, there decrease in the pressure because okay, I want to explain you this thing. Just imagine when a patient is taking breath. Okay, the patient is taking breath also. Naturally, the patient is taking breath. So there is a decrease and increase in the pressure over here because the patient is breathing. So that's why there's increase and decrease in the pressure. With inspiration, it goes down. With expiration, it goes up, goes down, goes up, goes up. So this is called tidling. And which is present in the water seal because with the lungs is moving. So with if the patient expiration goes up, down, goes up, goes down. That's why there is a tidling, goes up. Okay. Can you see this? There's a bottle. Wait, let me show you. Can you see there is something? Wait, let me show you. Can you see patient pressure float ball? So this chamber, this small chamber over here, can you see this? Okay, give me one. Taking time. Can you see the black color dot over here?
Yes, ma'am.
Plus 1, plus 2. So it goes up, it goes down. It goes up, it goes down. Okay. So pressure float balls also goes up, goes down. It's float. It goes up, it goes down. So tidal. This is what we want. Okay, we want. Okay. Now write it down. Tiding is expected. Continuous bubbling is not expected. Continuous bubbling is not expected at all. Understood?
Yes, ma'am.
Uzma?
Yes.
Yes.
Yes, ma'am.
If you cannot speak, if your vocal cords are not moving, I understood. Your hands are moving, type it out then.
Yes.
Next. There should be no continuous bubbling. Continuous bubbling means there's some kind of air is leaking. Okay, there should be no continuous bubbling.
Monitor.
Okay, next we are talking about last is your
Suctioning.
suction control. You can call
Suction.
it as air leak chamber also, to prevent the air leak chamber. Next. Okay. It control your suction. Okay. There is continuous bubbling. Yes. Because the air is moving out from the vent. Continuous bubbling is present. This is expected. This is normal. Okay. If there is very low bubbles, low bubbling means there is low pressure.
Madam,
bubbling
blocked. Tube is blocked.
Yes. It can also be there. Yes. Okay. If there is high bubbling, too much of bubbling, it means that there is high pressure. So whenever these two conditions, check the pressure. There should be continuous suction. If there's intermediate suction, bubbling, just report. Intermediate, we want continuous bubbles. If there is discontinued bubbling or intermediate bubbling, report. Okay. In air leak, okay, but in water seal, we can have some intermediate bubbling. It's okay. Some intermediate bubbles are okay. Understood till now?
Then when we have to report, ma'am?
When there is intermediate bubbling in suction control chamber, you need to report. Because we want continuous bubbling in suction control chamber. Understood?
Yes, ma'am.
Okay. Govindraj,
Yes.
are you alive?
Yes, madam.
Then why can't I see you?
Intermediate bubbling or suction control.
Okay. Clear? Let's talk about something very, very important is what is the nursing management? Okay, nursing management means check the vital sign. Okay.
Ma'am, check water level daily.
Sorry?
Check water level daily.
Yes, very good. Pressure also, water level also. At 2 centimeter, it is you don't have to worry about because there's a preset water is whenever you open a chest tube box, no, there will be in water in a chamber will be given. So you need to pour that in water seal chamber. Okay, there is a port where we pour water into the chamber. Depending on the company to company, but maximum 20 ml water is being kept in that bottle. Okay, so
But pressure on the pressure.
We need to monitor the water movement.
yes, you need to monitor the breath of a patient. Okay,
Yes.
breath of the patient, and you have to monitor the 3 chambers that I've already told you. Okay, you have to check the water level of water seal chamber. You have to check the level of the water. Okay, it should not go up, it should not go down. Sorry.
And we have to put the extra water bottle beside the bedside table in case.
In case when there's when there's a change in the water, yes, you are going to put. Okay. Next.
Sir, we have to check pressure.
Yes, pressure also, but chest tube should be always kept below the
chest level.
Below the
Chest
chest.
level.
Below
Chest
the
level.
waist. Not at the chest level, below the waist. Below the waist. Even when patient is moving, it should be below the waist. Even when you are even when you are taking a patient out for ambulation or something like this, it should be kept below the waist level. Understood?
Yes, ma'am.
Okay.
Yes.
Next.
Check the inject site. Any leakage or any oozing.
Sorry?
So tube insert site, no. So we need to check any oozing or
Yes, that I won't tell you. You're going to check overall the patients. Okay. Next, at the bedside, there should be occlusive dressing.
See.
dressing. Yeah.
And understand what is the need of this. Okay. There can be two phenomena can happen. Two things can happen. The first problem can arise when
The
the
tube can come out.
tubing is being removed or dislodged from this end. Okay. For example, when a patient is moving or patient is very combative and the patient has removed its chest tube from the lungs, what will you do at that moment of time? That's why we have already asked you to place a occlusive dressing at the
Exclusive dressing.
bedside. Okay. So understand, when a chest tube is dislodged from patient end, when the chest tube is dislodged from patient's end, then first, if a question is asking what is the first management, what is the first thing that you will do? Put a gloved hand on the chest. Just imagine if there's a chest tube over here, then what I'm going to do, I'm going to wear a glove. Okay, listen to me one thing. I was teaching some student about the same thing, like gloved hand. They thought we are going to put glove over here and put on like I don't know what they thought, like put a glove and then our hand and seal it like this. No, wear glove, then put your gloved hand. Gloved hand means wearing a glove, then putting on the seal. Just imagine there's a seal. Imagine this is a seal, okay? So you're going to put a glove and put your hand, seal it first. First management is you seal with your gloved hand, okay? What other student thought that we are just pasting a glove on this? No, do not paste glove like this. It was very funny. Gloved hand, okay? Leave it. So second best intervention is going to be occlude the site with three-sided tape. Occlude the site with three-sided tape. Okay, just imagine. This is the opening. So you're going to put a tape, one side, two sides.
Are you there, ma'am? Ma'am?
Maybe some network issue from ma'am's side.
Okay.
Shashikala is the host now.
Yeah. Tell me, Shashkala, about the chest tubes, please.
No.
Yes, you have to tell.
I'm like Kuti Papa. I'm like Chota girl.
You got a chance to teach us.
Bhavna, you also got teachers.
No,
English teachers talking.
now your dream is to become a tutor, right? Or lecturer. So go for it.
That smile, she's done.
8 o'clock, ma'am.
The sterile water always should be 20 centimeters level. Okay. And we'll tie the chest tube to the bed frames. I think it's break time.
What happened to all of you?
And ma'am, we are there, ma'am. You are disconnected.
So it's my end.
Yeah.
Yes.
Okay. So leave it. Just understand one thing. What I have taught till now, I have said that okay, when we are just imagine the tube has been dislodged from here. First thing you are going to do, put a glove hand. Second thing, tape it with 3-sided tape. Okay, so leaving one space for the movement of air, and you're going to secure it. Understood?
Yes, ma'am.
It's
One
okay, Usma.
side
You can go.
we tried to one side will open and three side we were cover to the
Yes,
patient.
because if you're going to close it from all the
Dislodged.
4 sides, it is going to build up too much of pressure, and it can further damage.
Yes.
That's why.
Okay.
Okay. Now come, if a tube is being dislodged from the tube side or from the suction from the chamber, the tube is being removed from here. What will you do?
Put it in the water.
First step, clamp it. Clamp. Clamp. Second, the first immediate action, if the question is asking you immediate, then go for clamping. If a question is asking you best, what is the best thing that you can do is to put this tube into a sterile water or sterile NS. Just open an NS bottle, put this thing and secure it tightly, making it a negative pressure. Do not break the seal. Do not break the negative seal. Okay. Understood?
Yes, ma'am.
Everyone?
Ma'am.
Ma'am, we can't clamp the chest tube more than 10 seconds.
No, not 10 seconds. We
No.
cannot clamp it for more than 50 seconds, 15 seconds.
15.
RN can never clamp the chest tube. RN can never clamp chest tube until and unless it is required emergently and not more than 15 seconds. Not more than 15 seconds. Mean that RN cannot clamp chest tube for more than 15 seconds. Never clamp it. You will increase the pressure. When you will increase the pressure, you will increase more pressure into this area and it will further going to collapse the lungs. Okay? Understood?
Yes, ma'am.
There is one thing which is called subcutaneous emphysema. Does anyone have heard of this term, subcutaneous emphysema? Let me show you subcutaneous emphysema.
We seen the patient.
Oh, you have seen it. Who can you just tell me who's this?
Shashikala.
Shashikal.
Air accumulated over the subcutaneous, ma'am.
Okay.
When I hold the patient hand,
Bubbles?
sound will, yes, bubble
Yes.
sound will come.
Okay. You must have received your parcels from Nykaa, Flipkart, Amazon. Okay. What are delivery partners over there in Pakistan, Suban? Farhad? Farhad?
What delivery partners? Yes, ma'am.
Like online shopping?
Ma'am, Amazon, Alibaba,
Amazon?
Daraz.
Sorry?
There are,
Alibaba.
I said Daraz, Alibaba,
Okay, you have Daraz,
Naheed.
you have Alibaba.
Most of them using Taraz.
Cameo.
Taraz is very famous in
Yeah.
Pakistan for
Okay,
online shop.
Taraz. Okay, so there's Taraz. So they wrap whenever we are just purchasing some glass item, so they wrap in a bubble packing. Do you know that
Yes.
bubble?
Yes,
When
ma'am.
we can
In
Yes.
just
childhood, I
burst the
used to.
fingers and
And
very,
when we
very
are
therapeutic.
free and we try to blasting.
Yes, that that bubble wraps. So similarly, when a patient is having this kind of problem, okay, this is also called subcutaneous emphysema. This is known as subcutaneous emphysema, basically. Let me show you the image of subcutaneous emphysema.
So what will happen, ma'am? Like if you hold the hand, you can feel that bubble wrap.
Sorry?
What will happen, ma'am? Like when we hold the patient hand, we can feel the bubble wrap.
I'm
sound.
sorry?
Sorry. Do we hear the bubble wrap sounds?
Yes, yes, you can hear it, but in very severe to severity. You can hear that type of feelings. Ask, uh, ask, ask Shashikala. Shashikala, did you hear that?
Heard, ma'am, but we can feel.
Yes, we can feel that subcutaneous. What is
Like
subcutaneous layer?
patient,
Anyone can tell me?
I think third one, ma'am. First
Yes.
is epidermis, second is dermis,
Beneath
and third
the
Very
one.
good.
skin. Beneath the skin.
Yes. Beneath the skin. Sub means cutaneous means skin. Sub means below. So below the skin. Under the skin, beneath the skin. Okay. So classical example of subcutaneous emphysema. Subcutaneous emphysema is not expected and you need to report it. Subcutaneous emphysema is not expected. You need to report this thing. See the eyes, see the skin of this patient. So this is called as subcutaneous emphysema. Okay. This is not expected. This is not normal and you need to report. Can you see look at this case study? It's very effective. A 65-year-old gentleman was brought in via ambulance as a rescue call to the accident and emergency department. He has symptom of difficulty breathing, facial swelling, and a voice of nasal quality. He was discharged 3 days prior to the cardiothoracic unit to another hospital following an elective left upper lobectomy for a suspicion lesion. He was sent home with dihydrocodeine and having never taken any opioid-based medication patterns. He suffered from hypertension and took amlodipine. It was a non-smoker and had not had any lung problem prior to this. And this is a family history. Can you see this patient? This is the case. Okay,
Yes, ma'am.
this is subcutaneous. Let me show you the more.
Can I ask one question?
Yes, please.
Term emphysema is concisely associated with lungs, and there is a facial orbital edema. So we can call it to subcutaneous emphysema.
You have said that subcutaneous emphysema is the term which is coined for the lungs. Yes. After that, what did you say?
I said the image that you have shown us on screen. This is clearly edema, water present under the eyes, over the eyes, and sinus. So we also use the term emphysema for this feature.
No, no. Emphysema means air cavity. Emphysema means air cavity. When I taught you about emphysema, the first lecture that we have discussed about chronic bronchitis and emphysema, what I have taught you, emphysema means when your alveolus get destructed and the air is filled in those cavities called emphysema. Any cavity which is filled with air is called emphysema. And in your skin layer, if there is an air is being
Water
accumulated, this
accumulation.
is called subcutaneous emphysema. You
Okay.
cannot call them as emphysema because emphysema is originating word is your air in air of sac of airs. If it is present in between beneath your skin, you will call it uh, subcutaneous emphysema. And when it's present in your lungs, simply you can call it emphysema. Okay.
Okay.
And this and those terms is known as edema. Fluid in this is called as edema, not emphysema.
Water logging in tissues. Okay.
Yeah, this is edema, and edema depend upon the type, pitting or non-pitting.
Yes.
Understood? This is the difference.
Yes, ma'am. Thank you.
Yes, very good. Okay, now let's okay. Cryptus sound not expected. So whenever you want to palpate the area around this chest tube, there will be some fluid or air molecules. This is they when you press this, there will be cryptus sound, which is not expected. Okay, this is also not expected. Understood? Okay. Did you understood the lecture till now?
Yes, ma'am.
Any doubt? I know I do
Yes,
not take,
ma'am.
I just take a continuous class for 2 hours. But if you are okay with it from next time, you can just tell me because I'm all into the topic and I just do not think about giving you break. Are you okay with it not taking break or you want break?
How
We
much
need a
more?
I am okay to study without break.
Yeah, because I think without breaks makes things better. Like it has been like one
Me too,
hour
ma'am.
15, it has been like 1 hour 45 minutes,
Yes.
46 minutes. Yeah, so it's good to study for one like this rather than taking 10-hour break, 15 minutes break, and then we are we don't the next
most student
half
they
the next
want
interval doesn't feel like uh passive learning. That's why I feel like make it one go, make it
And
one
break
session.
also allow to engage other activities
Yeah,
and distraction, act as a distraction.
yeah. So
I
this,
think according to me, ma'am, break is a brain relaxation and also our brain hormone or transmitter. When we having a hungry or thirsty, in that case, when we are eating some tea or a coffee, so brain will relax. I think so. Break is also
yes.
part of study, ma'am.
Yeah, it's not a part of it, but okay, next time I will think of giving a break when I feel like, okay. So depend
Okay.
upon my conditions. I have more saying in this because it depends upon the topic to topic. This topic was so interesting that I want to complete in one go because I know I will repeat it one time, two times, three times, four times, six times, seven times, so you can make it easy for you to understand from basic to the more complex thing. Okay, sometime when I have a shorter topics, on those day I will give you a break so you can get much more clarity about things. Okay, understand one thing. Tomorrow we are going to finish with our respiratory. There's not much topic left in respiratory. We have complete all the drugs. Okay, we have completed all the drugs. Major topics related to respiratory we have completed. Anatomy, physiology we have in some small topics that I will talk to you with some kind of respiratory therapy or some kind of respiratory therapy, some ventilator I'm going to talk about, and some small topics that I'm going to talk about tomorrow. We are going to discuss question tomorrow, and from day after tomorrow, I'm going to be starting with your cardiology or nursing foundation, depending on what I think will be your priority. Okay.
Hello, ma'am.
Yes.
Can you hear me? Okay, ma'am. I have a
Yes.
question. Just for suggestion. You try to teach or taught us like teach like with the pharmacology drugs, like when tube is dislodged or a blockage, and that time we will try to use streptokinase drugs or this kind of drug. They are also using in a blockage of chest tube.
Yeah,
So
we
I
use,
think
but
to try to teach with pharmacological drugs.
listen, if I talk about pharmacology of respiratory, there are streptokinase. What is streptokinase? This is a clot buster. So actually, we don't want, if we are draining a hemothorax from your tubing,
Ma'am, that is
we will
just
line with
suggestion.
the
Just
heparin or
suggestion.
streptokinase.
Most
We
of
can give at
teacher
that
they trying
moment of
to
time.
when they are most of teacher, ma'am, they are elaborating first of disease pathophysiology, then their complication, then they try to understand to the student concept, and after that they are complication, intervention, and pharmacology. I think so. In that case, we will understand properly.
So so your suggestion is this ki I should talk about disease condition, then pharmacology. This way.
Pharmacology also. Which pharmacology connected with the disease?
Yes. Like yesterday we discussed about TB, and I thought that TB drug will be most effective when I teach about TB. That time I taught
Yeah,
you. When I thought that
my
asthma and
concern is that.
COPD, then I taught you about drugs related to asthma and COPD now. There is no drug related with chest tube. That's why I have not taught you in this thing. Streptokinase, you're talking?
If you may, in future, when you are taught us pharmacology, only pharmacology, that time we will understand very difficult to understand, to try to understand the very difficult. When you were teaching taught on according to disease with pharmacology, so that is very easy to understand, I think so.
I will make sure that you understand topics very clearly. Whenever you haven't done it, I will ask you from this thing. But I think from my end, respiratory, you all have understood respiratory to a
Yeah,
good point,
but
right?
you were talking about dislodge of tube, chest tube, and that case, and that will happen. That will happen. Also, blockage of drain. In that case, which one drugs we will use in that condition? Streptokinase and also coagulation drugs. So that is my
Yes.
point.
But depending upon the situation, if we are draining any kind of air, then there's no need of streptokinase. If I'm draining hemothorax, then I will go for streptokinase. Or I can just line
Yeah,
my tubing with heparin.
but when I also it's attempt mock test from NCLEX side, and they were when they are giving us mock test respiratory failure, they also asking about blockage of tube and which drugs we are using in that condition, and what is the intervention of the tube, and what is the dressing intervention when dislodge of tube. So that is also, I think, that
Yeah,
is
I
connected.
understand, Amul. Next onwards, I will keep your points in mind. Okay. And
I
now do one
just
thing.
suggest you, ma'am. I just
No, no,
suggest you.
I appreciate your suggestion. Don't worry. I am always open for this thing. I will add more pharmacology topics related to these all. Don't worry. But what I'm saying, the thing, go home, do this question. I'm going to give you more question on chest tube. If you feel anything which is being missed, come to me. I will clarify more on those topics. Okay. If you think,
Okay,
then
thank
only.
you.
But I think this will be more
Please
than
don't
enough
mind.
for the chest tubes and everything.
Okay.
Okay.
Thank you. Thank you, ma'am.
Always. Okay. So understood, everyone?
Yes,
Any
ma'am.
doubt?
Yes, ma'am.
No, ma'am.
Clear.
Okay. Thank you and have a good day. This will be your break. So, and I will end the class. Go take your coffee.